Your doctor has recommended that you have a colonoscopy to screen for colon polyps and colon cancer. This can be a life-saving test. But what exactly are colon polyps and colon cancer, and are you really at risk? Colon cancer, or colorectal cancer as it is more properly known, is cancer that develops in the colon or rectum. The colon and rectum are part of the digestive system, which is also called the gastrointestinal or GI system. The gastrointestinal system processes food and rids the body of solid waste. Colorectal cancer usually develops slowly over a period of many years. Most cancers begin as a non-cancerous polyp that with time may change into cancer. A polyp is a growth of tissue on the lining of the colon or rectum. Anyone can get colorectal cancer. The lifetime risk of being diagnosed with the disease is about 5 to 6%. It is the second most common cause of cancer death in the U.S. As with other types of cancer, a family history of colorectal cancer is a significant risk factor. But that accounts for only 20 to 25% of cases. 75% of cases occur in people without a family history of the disease. Other risk factors include age. Overall, 91% of new cases occur in people older than 50. The rate is more than 50 times higher in people aged 60 to 79 than in those younger than 40. Sex. Overall, colorectal cancer rates are higher in men than in women, but both men and women should undergo screening. Race. The incidence rates of colorectal cancer in African American men and women is about 15% higher than in white men and women, and the mortality rate in African Americans is about 40% higher. Most polyps and many early cancers do not cause symptoms. However, symptoms such as a change in bowel habits, a feeling that you need to have a bowel movement that is not relieved by doing so, blood in the stool, cramping or steady abdominal pain, or weakness and fatigue need to be evaluated by a physician who can determine the cause of these symptoms. The best way to find polyps and possibly cure early cancer is by having a screening colonoscopy. Both the American Cancer Society and the U.S. Preventive Services Task Force recommend that all men and women aged 50 and older should have a colorectal cancer screening test performed. The test with the highest rate of accuracy in detecting polyps or cancer is the colonoscopy. A recent national study suggests that colonoscopy could prevent up to 90% of colon cancers. Colonoscopy is the visual examination of the colon using a lighted, flexible scope. The colon begins in the lower right abdomen and looks like a big question mark as it moves up and around the abdomen, ending in the rectum. It is about 5 feet long. The colon has a number of functions, including drawing water from liquid waste so that solid waste is produced. Even without any symptoms or family history, it is recommended that everyone age 50 and over have a colonoscopy screening to get the best view of the entire colon, to look for polyps that could develop into cancer. Here's how it works. It starts the day before the colonoscopy is performed with preparation of the colon. To get the full benefits of the exam, the colon must be clean and free of waste matter. You must go on a diet of clear liquids on the day preceding the test. Clear liquids include water, broth, coffee or tea with no cream, some soft drinks, and other liquids. You will be given a list of acceptable liquids. Do not eat any solid food, but you can take your usual prescription medications unless your doctor advises you otherwise. You will also take special laxatives the day before your procedure. You will be given prep instructions when you make your appointment. It's important that the liquid diet be followed and the laxatives be taken exactly as prescribed in order for the colon to be cleaned adequately. Because you will be sedated, you must arrange in advance to have someone bring you to the center and wait while the colonoscopy is done in order to drive you home. Sign in at the front desk and have a seat. Your name will be called when it is time for you to go back to the pre-procedure room. You'll put on a hospital gown. Certain patients may be given antibiotics at this point. You will have an intravenous line placed for the sedative to be given. Monitors are attached to show your blood pressure, pulse rate, and oxygen level of the blood. And you'll be given supplemental oxygen through a nose tube. When you are properly sedated, your doctor will insert the colonoscope through the anus and move it gently around the bends of the colon. If the doctor sees a polyp, it can often be removed through the colonoscope painlessly during the colonoscopy. If other problems are seen, the doctor can also perform a biopsy to obtain small tissue specimens for microscopic analysis. The doctor may also treat sites that are bleeding. The procedure takes from 15 to 30 minutes, and you will recover from the sedation promptly. You will go back to the pre-procedure room where you started to be monitored until the sedation wears off. When you are fully awake, the doctor will usually talk to you and the person who brought you about the findings. And if there was a biopsy, the results will have to come back from the lab before the doctor can discuss them with you. This may take 48 to 72 hours. You'll be ready to go home then. You may feel some discomfort like a bloated feeling, and you will pass a lot of gas because of the air that is in your colon as a result of the test. You should take the remainder of the day off to rest. You should be able to go back to your regular activities the next day. The advantages of having a colonoscopy far outweigh the inconvenience of the preparation and procedure. It is virtually painless, and it is the best way to detect colon polyps or early colorectal cancer. What are the possible complications from having a colonoscopy? Occasionally, people have some bleeding following the test. Some may also have a reaction to the medicine used. The most serious complication is perforation of the colon during the test. It is a rare occurrence, but should that happen, it will be treated immediately and may require surgery. And although colonoscopy is the preferred method for colon cancer screening, small lesions can be missed, especially in a poorly prepared colon. What does the procedure cost? Most people have health insurance, but these policies usually include a deductible or co-payment. There will be additional charges for anesthesia, and if biopsies were obtained or polyps removed, there will be pathology charges. Our staff will help you determine the cost prior to the procedure. What if I have other problems? If you have heart disease, lung disease, diabetes, renal disease, or an artificial heart valve, or if you are on blood thinners such as Coumadin, Plavix, or Pledol, then you will need to see one of our physicians before the colonoscopy. My test is scheduled for late afternoon. Can I eat something prior to the test? No, but you may have just clear liquids up until 4 hours prior to your appointment. Can I take aspirin prior to the test? You can take aspirin and other anti-inflammatory drugs without interruption. Can I take iron? Do not take iron for 7 days prior to the test. Couldn't I have the new virtual colonoscopy? Yes, we have equipment to perform virtual colonoscopy. But because virtual colonoscopy is new, it has not been shown to be equivalent to regular colonoscopy, nor is it recognized by insurance companies yet, so it is not a covered service. You still have to do the same preparation the day before as for the regular colonoscopy. And with the regular colonoscopy, the doctor can remove polyps or collect tissue for biopsy at the time of the test.